think one of the biggest challenges is reaching out to isolated, rural regions in the country. When I say isolated, I really mean isolated, where they are still not part of the national grid in health, in education, in just political, economic, and social support. They really are remote. MJP's focus is integrated development. Again, one of the first things we did when we went into this area, we started to rebuild the health facilities. The biggest challenge, I would have to say, is receiving qualified medical or healthcare practitioners that actually know how to practice medicine. The best and the brightest talent is, again, staying in places like Siem Reap or Phnom Penh.
Here in Samlot, we do have MJPs, the main NGOs who support the government in building the capacity, building the, what we can say, hardware and software, infrastructures, and also the training to build the capacities. And the main purpose are to be sure that the government in the future will be own the projects, because we are doing now to build the capacity of the government, and we think that one day in the future the government will be able to manage to own the projects by themselves without MJP's support.
Our partnership with Improving Global Health has been fantastic. The NHS fellows bring so much value to this program. The energy that they bring to the table, their ideas, their creativity, it's inspiring. They provided so much value to not only to our teams, but to the local healthcare workers in Sam Lot. So how it works is we have the NHS fellows that arrive, and they're assigned working with one of our local healthcare team members. And for 6 months, they will be working with the Cambodians hand in hand and designing projects.
I think the community earns a lot, benefits a lot from having us MJP and UK fellows working with them, educate them. I have gained a lot of experience working with them. All UK fellows, they came here, they have different style of teaching. So I learned from them like how to give presentation, teaching by using role play, scenario, yes, and some kind of group discussion that I have never done before. And also it's motivated me to be more confident.
So can I ask, who's washed their hands today? So the problems that the community here in Samlot experience are ones to do with poverty and lower educational attainment. Things like preventable diseases in children, such as diarrhoea and pneumonias, infectious diseases, are still really quite prevalent. My focus is on child health. I've got a few different projects and arms and umbrellas going on, and I suppose the overall is a kind of child health, environment and well-being project. I'm also kind of in charge of the hygiene and sanitation project within Samlot. I think IGH is a kind of innovative, new, different programme to those kind of slightly more established patterns of one hospital linking to another, providing a lot of clinical expertise and teaching, whereas this is something completely different, and it's really a balance between what we get and gain from Cambodia and our colleagues in Cambodia and the experiences we have here, and then what we're able to bring to the organisation and the communities that we work with.
More and more we're recognising that non-communicable diseases, ischemic heart disease, stroke disease, long-term respiratory diseases from smoking, these are a massive health burden out here in Cambodia, and a lot of our project work here is now switching to target that as well as infectious disease. My project is looking at household air pollution and the healthcare burdens that are arising from cooking solid fuels indoors. Now, actually, this reaches out to the women in Samlot because 99% of the cooks here are women. It empowers women to do something to change their own healthcare and that of their children. It has a very direct link to the environment, and it's the cutting down of trees and provision of solid fuels that is driving this healthcare problem, and we need to attack both at the same time.
I'm working on the YES project. It's youth empowerment and special support, and it's a multi-departmental project involving healthcare, education and gender empowerment, and it's designed to support vulnerable children and young adults who either are directly or indirectly affected by landmines or road traffic accidents, or who have a parent with a disabling condition such as a mental health condition or HIV or AIDS. A family of 4 children, and the mother of the family experienced an acute psychotic episode 18 months ago. With MJP's assistance, she was able to attend hospital appointments in Battambang, be accompanied by her family, and pick up medication for 6 months. She's now recovered.
I guess I've really enjoyed getting to know these people, getting to know the local Cambodians and working with this team. They're amazing people and they are a real inspiration. They are enacting serious change here within Samlot, and it's a real privilege to be part of their team and to get to know them and work with them so closely has been a really great honour. Anyone who is interested in pushing themselves beyond the norm should make this journey, because I think that I know myself, and I've seen it within others here, we've learnt things that we never knew about ourselves and our own capabilities, and I think that deep down we've all got these skills, we just don't know it, and I think that I have learnt so much and had so much fun doing it that I just think anyone who has an interest in furthering themselves should look at something like this.